Okay, hi everyone. My name is Wenru Wang, and I'm finishing my second year in our AIS PhD program. So I'm really happy to give you a brief view of the project that me and my colleague Xinxin Wang and Professor Miklos is doing. And we named this project Systemic View of COVID-19 Pandemic. And here we go. So before we start, I think at beginning of the class and with Nick and Adam's presentation, we have already recognized that some of the numbers, the measurements about confirmed cases, about the death tolls are not that accurate or are not very comprehensive because there are other issues that need to be considered but not considered into the current measurements. And this is the decision tree that we make, and it's kind of similar to what Professor Miklos presented at the beginning of the class. But I just want to mention that from this decision tree, we can see some groups need to be paid attention to. For example, although we have the confirmed COVID-19 group, these are the groups that are getting tested, but there are groups that they have the symptom, but they are not having the test resources, so they cannot get tested, and they are not recognized as COVID-19 patients. And also there are groups that they don't show symptoms. Right here. So these two groups, unrecognized COVID patients and no symptom COVID patients, they all going back to normal life, and they will contaminate more healthy people. And also, even those that does not infected by the virus, there are people that they carrying fatal diseases like cancer or other diseases that need to visit the hospital regularly. But with current situation, most of the hospitals they will reserve their medical resources to treat COVID patients. Therefore, there are not available resources to the people that have underlying diseases, especially for those that they have fatal diseases. So the number of the death tolls will be impacted by not only the confirmed COVID patients, but also the people that they are dying from their underlying diseases, but they did not get treatment as they usually should be. So I want to say that this tree is not only say that the measurements is not accurate because it didn't include many other groups that need to be focused on, but also the numbers are not static, meaning that they are changing every day, and also they are interrelated to each other, and they are impacted by social interventions such as the government measurements or like the hospital example that I just used. The government asks the hospitals to reserve the resources to treat COVID-19 patients. So this kind of social interventions will change the numbers, and the numbers, the different measurements, they will interact with each other and has a dynamic changing effects. So that's why we want to use the idea of system dynamic, and the system dynamic methodology is created by MIT scholar J. Forrester in 1961, and it is the science of feedback behavior in social systems. So the theory, it basically describes social behavior from a feedback system view, and the feedback system is constructed as a loop in this theory. And to visualize the feedback system, we use causal loop diagrams in this theory. So we're using these diagrams to picture how different variables in a system are interrelated. And there are two different feedback loops here. One is positive feedback, the other is negative feedback. So with the positive feedback, this is a self-reinforcing process that causes exponential growth. And for the negative feedback, it is a reaction that causes a decrease in function, and it will occur in response to some kind of stimulus. And here I give you more direct example here. So on the top is a negative feedback loop, and starting from the number of prey. So a higher number of prey will lead to a higher number of predators. So this is indicated by the top arrow here and a plus sign. And a higher number of predators will, however, lead to a lower number of prey because they killed them. So this is indicated by the lower number, by the minus sign here. However, with declined predators, so ultimately with higher number of predators, there will be lower number of prey, and with the lower number of prey, there will be lower number of predators. So as you can see that the negative feedback tends to stabilize the system. And on the other hand, we say that the positive feedback loop is a reinforcing process. And by saying that, we mean we can see this example. So in an ideal world, so if you have more motivation, you will be more likely to get success. And with more success you achieved, there will be more motivation. Motivate you to chase more success. So in this positive feedback loop, we indicated this positive feedback using two plus signs. So you may ask, why use system dynamics? Okay, so with this graph here, you can see that there is a software named Xinxin, and we can use that to mathematically predict the pandemic with different levels of social interventions. So in this little example here, we have bank balance and earned interest, and this is a positive feedback loop. So with more bank balance, there will be higher earned interest, and with higher earned interest, your bank balance will be even higher. So we can key in different numbers in the bank balance, and it will automatically give you the dynamic change of the earned interest. That we think using the system dynamic could picture the pandemic with different levels of social interventions. And for the project approach, we want to use the theory of system dynamics to view the pandemic and its related social effects systemically. And second, we identify how different events and effects are interrelated by feedback loops. And the third step is to create a model to picture the events and effects in the pandemic. And the fourth step is we want to simulate the pandemic using the model and get more insights and new questions so that we can modify the model. And then at last, we want to validate and evaluate the model using different sources of data that we can get. And this framework is the one that we created using our system dynamic idea. And it pictures the differences between infected population here and reported cases. So we've talked about the reported cases number are off, and it is true because actually they are impacted by different inputs. So if we want to measure the population infected with COVID, you need to get the new infections here. But new infections does not equal to new reported cases. And these two different variables are impacted by different variables. So, for example, for the new reported cases, it will be impacted by test location capacity, the location numbers of COVID tests, and also the positive test rates. And here, the positive test rates does not only mean that what percentage of the tests are positive, but also we need to take the accuracy of the tests into account, because there are many false positive or false negative in the test results. So basically, the blue links here pictures the pandemic itself using different variables. But we also picture the different social effects interrelated to the pandemic. For example, the contact frequency here will be impacting the susceptible contacts, but it is also being impacted by the public awareness of pandemic, and also the effectiveness and the number of government policy. So I think this is where make our project unique, because we can simulate different effectiveness level and different numbers of government policy right here as a variable, and we can simulate with different key-ins. We can get different levels of contact frequency, and also we can get different levels of susceptible contacts, and eventually get different levels of new infections. So with that, I believe we will get different numbers with the current measurements. There are some equations for the variables that we use in the model. So you can see some of the variables could be calculated by other variables. But I think one question that we need to figure out is that some of the variables here are hard to measure using a number. So I think this is the next step that we need to think about. So basically, the purpose of this project is that we want to provide a systemic dynamic model, including feedback loops, for better understanding of the pandemic, because we've already talked about how dynamic the pandemic is, and how hard the measurements are to capture the current situation. And also, we want improve information provisioning for decision makings in public health, because those decision makers, they need to react quickly and appropriately. I think with the model that we created, and we can simulate how decision makers could react differently, and will result in different numbers of the pandemic situation. So with that, I think that wraps up my presentation, and I will really be appreciated for any suggestions and questions.